details once we get information from the airline. Also 2 overseas arrivals who have tested positive. They're also in hotel quarantine, which is great, and they've arrived from the Ukraine via Dubai. They've also been infectious on the flight, and the normal process for contact tracing for flights will occur. Some good news from yesterday is the case we referred to from Goondiwindi, just to confirm that she was not infectious in the community. That's been confirmed, and she's been transferred to Gold Coast Hospital. It's also worth mentioning that we mentioned a woman that linked from Cairns who travelled to Darwin, and the information we received from Northern Territory last night was that she hadn't been infectious in the community based on her testing and onset of symptoms. That information continues to evolve, and there's been further interviews with her today, which casts some doubt on her movements and also whether or not she was infectious in the community. We're working through that at the moment in conjunction with Northern Territory, but it's a really great reminder, and I would ask everyone in the Cairns, Cardwell, Innisfail region, if you've had any symptoms at all, to come forward and get tested so we can be completely certain. Also, it's a great reminder, if you're in the Cairns, Cardwell, Innisfail region, to come forward and get vaccinated. It's never too late, and it's always better to be safe. And it's a reminder for everyone that we get closer to 80%. If you haven't been vaccinated yet, come forward now, and it would be so lovely to be able to say we've hit the 80% first dose vaccination Monday, Tuesday next week for first dose. But that's, once we get first dose, we know we can get to second, and once we get to 80% second dose vaccination, everything starts to change for all of us in Queensland. So please, thank you to those who have been vaccinated, and to those who haven't, please come and get vaccinated today. Thank you.
Thanks. Well, it's great to have the Premier here in Stafford. Thank you so much for coming out, and obviously the acting show. Thank you. Locally, I just want to say thanks to Bunnings, to the health staff and to the community recovery staff who do such a great job with these pop-up vaccine hubs. We've done a really good job here in Stafford. For those who haven't had a first vaccination, please come down. For those who were here a few weeks ago, come down and get your second. It's the perfect opportunity. Right here at Bunnings, of course, it's also about supporting the community. Yesterday, the barbecue was in aid of the mighty Kedron Wavell Hockey Club, the Wolves. Today, it's the Newmarket State School. So come on down, do some DIY, grab a sausage and support a local school, and most importantly, get vaccinated. Thanks.
Thanks, Jimmy. Okay, happy to take some quick questions.
How confident are you that we will get to 90%? It's very slow time on those first doses.
I think you've seen, like in other states, they've been able to get there, and you know, I'm quite sure that we're going to see those last remaining Queenslanders come out and do it for themselves, their family and their community. Sorry? Yeah, we're on track to. Absolutely. Yeah, we're on track at this stage, yes. Yes, is my understanding, yes.
Premier, the health and sustainability modelling of those international borders at the same level as 80% is not reliable, even though it specifically states it supplies the jurisdictions with few or no location. When did the government decide the industry modelling wasn't good enough?
Well, that's not correct, so I reject the last part of your question. Yeah.
And would any modelling ever sway to change the international government?
Look, we had a really good I'll say this, we had a really good National Cabinet meeting on Friday. It was about 3 hours, so there was a lot of things that were discussed, and everybody is working collaboratively together. Everyone is working towards the national plan, recognising that people will reach those different targets at different times of the year, recognising that in New South Wales and Victoria, just over the weekend, they've had more cases and deaths than Queensland has had over the whole entire pandemic. So my job is to keep Queenslanders safe, and my job is to open Queensland safely as well. So that is why we are spearheading this vaccine program to get people vaccinated as quickly as possible. You can go to your GP, you can go to your local pharmacy, or you can come to Bunnings and get vaccinated. Yep.
What is the government doing to push that vaccination message and make it easier for regional people to get vaccinated?
Yeah, thank you. People can go to their local GPs and they can go to their pharmacies. That has been set up by the federal government, and it was Queensland that pushed to have the availability of vaccines administered by your local pharmacy. So what we know very clearly is that when my ministers went out and travelled the length and breadth of Queensland, the vaccination rates increased between 3 and 4% in some of those centres we went to, which is great news. Down in the southeast, our vaccination rates are going very well. Like I said, I'm concerned about regional Queensland. We need to get more people in regional Queensland vaccinated. But also too, I really need to stress to those families living in our tourism hotspots, especially places like Gold Coast, Whitsunday and Cairns, your vaccination rates need to lift, because when we get to 80% double dose in mid-December, we are going to see an influx of people. People want to see their loved ones, people want to see their families, and people have approached me and told me how much they're looking forward to seeing that. And if your communities are not highly vaccinated, the Delta virus will spread and we will see people in hospital. So it's a big wake-up call to everyone. The clock is ticking. Please come and get vaccinated as quickly and safely as possible. Oh, we've already had a meeting. Our Queensland Disaster Management Group has already had a meeting in preparation for the onset of our cyclone season, and the Bureau is actually predicting quite a bit of widespread rain as well. And we work very closely. The councils have their local disaster management groups. We are very well tested when it comes to dealing with natural disasters in Queensland. Sorry? About anti-vax. I just say to everyone, please get vaccinated. It is safe. I've had my double dose of vaccine. Nearly everybody here has had their double dose of vaccine. There's people behind me here that are lining up to get their vaccine. Please come and get it, and especially our young people. It's really important. If you've got grandparents and you want to make sure that they're safe, you need to come and get your vaccine. I think we're on track, so I'm very comfortable where we are, but I would like to see it. If people want to reach those milestones earlier, the more people that come out, it means that we're going to reach those milestones earlier. We'll be re-evaluating that, especially when we get to that 80%, so we'll have more to say about that next week. Yeah, sure.
Is this Gundawindi cluster sort of at an end? Do you think? Is it now under control? What's your assessment of that?
Look, we're cautiously optimistic. It's early days still. We haven't got through a full incubation period. So at this stage, the fact there's been no new cases, no community transmission, the only cases have been identified close contacts, is really positive news. And I think it's testament again, as I said yesterday, to the Gundawindi community with their high vaccination rates. So optimistic, hopeful, not quite there.
Is it surprising to you? I mean, we keep getting these Delta outbreaks, they seem to be contained, or what do you expect to happen?
Look, I think Queensland has done an amazing job, and Queenslanders have done an amazing job. People have got vaccinated, people have identified and watched the venues of concern and come forward, and they've gone and got tested when there have been community cases. And it is a team effort. It's not just us standing here, it's not just the health system, it's the people of Queensland that have helped stamp out these little outbreaks when they've occurred. And we're in an amazing situation that we're edging towards 80% double dose vaccination without widespread COVID. That is so much better than some of our southern counterparts, and it places us in a really good position moving forward.
So I guess with this Gundawindi situation, as you said, they have a high vaccination rate, is potentially why they feel it's still a bit better. What would your advice based on that to other regional communities?
Look, it is a wonderful test case, and I'd say to all communities, look at Gundawindi, over 80% double vaccinated, and we've been able to get on top of this. I'd ask every community to get to over 80% double vaccinated, so if we do get cases, and we will get cases as borders open up, it is inevitable that hopefully those cases don't spread and we can jump on them and control them as we've done in Gundawindi.
Dr. Atkins, is the situation in Moree worry you at all? Seeing that the cluster was what happens when borders open up?
There are a number of different situations in Moree with a number of events, and it is a worry, and it probably tells the message to all of us that we need to get vaccinated. And it's the same message. The higher the vaccination rates, the less likely we'll have these events.
Thanks, everyone. Thanks for coming out on a Sunday. You smell those sausages.
Thank you.